If you have Medicare, and this includes both Original Medicare and Medicare Advantage health plans, you have rights. Acentra Health is the beneficiary and family-centered care quality improvement organization for the 29 states highlighted on this map. Acentra Health helps people with Medicare file complaints about the quality of healthcare services they have received and make requests to appeal a hospital discharge, observation status, admission hospital-issued notices of non-coverage, or the stopping of skilled services such as physical therapy. We also offer immediate advocacy services when issues need to be taken care of right away. This video goes over how to file an appeal. Here are some examples of when you may want to call Acentra Health to make an appeal. I was admitted to the hospital. I was told that I would be discharged, but I don't feel like I'm ready to go home. Can I stay in the hospital? Will Medicare continue to pay for it? I have been getting physical therapy visits from a home health agency. On my last visit, the therapist told me my services would be ending. However, I feel like I still need physical therapy. How can I continue to get these services? Will Medicare still pay for it? There are different types of appeals: hospital discharge appeals, skilled service termination appeals, observation appeals, and admission hospital-issued notices of non-coverage, or HINs. Let's take a closer look at each one. The first type of appeal is called a hospital discharge appeal. What happens if you are a patient in the hospital and you are being sent home, but you feel you aren't ready to leave yet? You can call Acentra Health and ask to appeal or stop the discharge. It is important to know that to appeal your hospital discharge, you must be an inpatient. Therefore, be sure to ask your doctor what status you are in. At the time of your admission, and again before discharge, the hospital staff must give you a form called an Important Message from Medicare. This form includes the phone number for Acentra Health and tells you what you need to do to appeal the discharge. If the hospital staff did not give you this form, please ask for it. By law, the hospital must give you this information. When you call Acentra Health for an appeal, an independent physician reviewer will look at your medical record to see if you should stay in the hospital. If you are not able to call Acentra Health yourself, you can ask someone else, such as a family member or friend, to call for you. While you are in the hospital and Acentra Health is reviewing your appeal, you do not have to leave the hospital. If you have made a timely request for an appeal, Medicare will continue to cover your care during the review. Then, within 1 calendar day after Acentra Health gets all the information needed, you will get a phone call to let you know if Medicare will continue to pay for your stay in the hospital. You will also get a letter in the mail. If Acentra Health agrees with you about your appeal and you stay in the hospital, you will get another important message from Medicare with a new discharge date. When you get this form, you will need to appeal again if you are not ready to leave the hospital by the new discharge date. If Acentra Health disagrees with the appeal and you still don't feel ready to leave the hospital, there is still something you can do. When you get the phone call, Acentra Health will give you information about a reconsideration review. This is when another independent physician reviewer looks at your medical record and the appeal. You can request a reconsideration review while you're on this phone call, or you can call later when you decide. During the reconsideration review, Medicare may not continue to cover your hospital stay if the second physician reviewer agrees with the original decision. The next type of appeal is called a skilled service termination appeal. If you have Medicare, you have the right to appeal if you do not agree with the decision that your skilled services will be stopped. What are skilled services? A few examples include getting a visit from a nurse at a home health agency, receiving hospice services, and getting physical therapy. When your skilled services are ending, the staff must give you a form called a Notice of Medicare Non-Coverage. This notice shows you the date your skilled services will end, which is called the effective date. The notice will also tell you how to appeal and the phone number to call Acentra Health. If you are not able to call Acentra Health yourself, you can ask someone else, such as a family member or friend, to call for you. An independent physician reviewer will look at your medical record to see if the services should continue. You will then get a phone call about the results of the review. letting you know if Medicare will continue to cover your skilled services. If you don't agree with Acentra Health's decision, there is something that you can do. When you get the phone call, you can ask for a reconsideration review. This is when another independent physician reviewer will look at your medical record and appeal. During a reconsideration review, Medicare may not cover your skilled services if the second physician reviewer agrees with the original decision. The third type of appeal is the observation appeal. This is the process by which eligible beneficiaries with original Medicare can appeal hospital decisions to change their status from inpatient to outpatient under observation. This change matters because it can affect how much you pay and whether Medicare will cover your care in a skilled nursing facility after you leave the hospital. Staff must give you a form known as the Medicare Change of Status Notice. You or your representative may then call Acentra Health to request an appeal. An independent physician reviewer will look at your medical record to determine if you need to be an inpatient. You will receive a phone call about the results of the review, letting you know if your status will change to inpatient or if you will stay in observation. The last type of appeal is the admission hospital-issued notice of non-coverage. This is when the hospital tells you that your hospital admission will not be covered by Medicare. The hospital will issue the HIN notice, and you can appeal that decision. Acentra Health will then determine if your hospital stay is medically necessary and inform you by telephone and mail regarding that decision. If this video was helpful, please subscribe. Click the notification bell and you'll get notified whenever we post a new video. Thanks for watching. If you have questions about Acentra Health or resources we have available for people with Medicare, visit acentraQIO.com/Benny. There are also useful links and more information in the YouTube video description.